Today we will be discussing about a very important topic in community medicine, that is AEFI, which means adverse events following immunization. So our WHO has given a definition for AEFI. So it is any untoward medical occurrence that follows immunization, and that is some medical events that happens after this vaccination, and see, if which does not necessarily have a causal relationship with the usage of vaccine. That is, this particular reaction, this particular event, it can be due to the vaccine or may not be due to the vaccine, and it happens after this vaccination. So this is actually an AEFI is. So here the adverse event that we say is actually about uh, any unfavorable or unintended sign. For example, like fever, it can be a fever, or it can be swelling, it can be redness, likewise, or it can be an abnormal laboratory finding. That is, sometimes the platelet count can decrease after taking vaccination, sometimes HP can decrease, or sometimes some enzymes can be elevated. So it is all about it, and it can be a symptom or a disease. That is, like what it can be, sometimes it can lead to paralysis, or sometimes some infections like ear infections. And let's see what all these things are. So this is a definition given by WHO. And see, uh, the World Health Organization, that is WHO, and the Council for International Organization of Medical Science, that is CIOMS, had classified this AEFI into 5 categories, and this is very important. So the first one is vaccine product related reaction, and the other one is vaccine quality defect related reaction, immunization error related reaction, or immunization anxiety related reaction, or any coincidental events. And let's come to all these things in detail. So first one is vaccine product related reaction. So this is a event which means an adverse reaction that happens due to the inherent property of the vaccine itself. So when you consider the example, see, swelling of the limb after taking the DPT vaccine. So the vaccine product itself has a property to cause the swelling. So this is actually due to the property of the vaccine product itself. So that comes under vaccine product related reaction. And the next one is vaccine quality defect related reaction. So here this adverse event is due to the manufacturer of the vaccine. This is because there is a defect in the quality of the vaccine, right? Or there is a defect in the device which is provided by the manufacturer to administer this vaccine. So when you consider the example for this, suppose in the case of polio vaccine, so suppose if the manufacturer had failed to completely inactivate the polio virus, then what happens if this vaccine is injected to a person? The person will be infected by this disease, right? So paralytic polio after taking this polio vaccine is an example for this. Here the manufacturer didn't completely inactivated the polio virus. So as a result, the person is now having a disease due to that. So this is actually vaccine quality defect related reaction. And now we have the immunization error related reaction. So this is actually not because of the vaccine product or due to vaccine quality defect. This is actually due to what? Error which happened in handling of the vaccine, that is in storage or transport of the vaccine, or in prescription of the vaccine. Sometimes wrong dose can be prescribed, sometimes wrong vaccine itself can be prescribed, or it can be a error in administration. That is, suppose what if the needles that you use is not sterile, what if the vial is not sterile. So all these things that happens, it is due to an error in immunization, that is in vaccine handling or in prescription or in administration. So when you consider an example for this, see, infection due to contaminated multiviral dose. So that's an example. Now immunization anxiety related reaction. So this is actually not because of anything else, just because of tension or stress. So this, the main reaction happens here is actually fainting. And then next we have a coincidental event. A coincidental event does not come under any of these things. It is not due to the vaccine, or it is not due to the error in immunization. It is not due to anxiety. It is due to something else. For example, suppose a person was is having malaria, right? Only the mosquito has bitten this person, and it is having an incubation period, right? So the malarial parasite is already present in the body, but it is at the incubation period. The symptoms are not yet appear. But our patient is going to take the vaccine during this incubation period. And what happens after some days? The symptoms will appear, fever will develop. So here, this fever happened here is not because of this vaccine. It is because of the pre-existing condition of that patient. Suppose if the person already had a fever, the patient took a vaccine, and then the patient developed ear infection. So here the ear infection is not due to the vaccine, it is due to the fever that this patient has earlier. So that is a coincidental event. Now we are actually coming to all these categories in detail. We have 5 categories, and among them the 1 and 2 is the vaccine product related reaction, that is due to the property of the vaccine itself, and vaccine quality defect reaction. What is this? This is due to the defect of that manufacturer, that is the vaccine quality is not good. So here the reactions here can be a minor reaction, or it can be a severe reaction. So usually we have minor reactions, and the severe reactions are very rare, but still it is there. So when you consider minor reactions, they actually occur within a few hours of injection, and they only last for a short period of time. So this include the symptoms like pain, swelling, or redness at the site of injection. So when you consider some examples for the minor reaction, see, in all the case of minor reaction, the symptoms that you have is pain, local swelling. See, local pain, local swelling, or local redness at that particular site only. So for all these vaccines, we have some minor reactions also. Now we are coming to severe vaccine reactions. So here, suppose after taking vaccination, if the patient suddenly collapsed and the patient finds it difficult to breathe, the patient has having nausea, vomiting, severe stomach pain, or other pain at the other side, or there is redness and swelling all over the body. So this condition requires hospitalization, and if it is not hospitalized, it can even lead to death. So such kind of reactions, example anaphylaxis, which can happen after vaccination, it is a serious vaccine reaction. And now you need to understand one thing. We have two terms, that is serious and severe. So they are actually not saying they are different. Let me explain. So serious is something which is life threatening. Severe is used to describe intensity of an event. For example, suppose you take fever. Fever, in order to describe the intensity of fever, we can classify it as mild, moderate, or severe. So severe here actually means the maximum intensity for the fever. So severe doesn't mean it can lead to death. It requires hospitalization. It just describe what are the maximum intensity, maximum adverse event that can happen for a particular thing. So these are the difference between the two terms. Now let's consider some examples for the severe vaccine reactions. So these are the examples. Anaphylaxis is also there. There can be wheezing, there can be lymphadenitis. Likewise, now we are coming to immunization error-related reaction. We have already mentioned it is due to vaccine handling, an error in vaccine handling, or due to prescription, or due to administration. So here in vaccine handling, what can happen? Sometimes the transport or during the storage, if it is not done properly, then the quality of the vaccine can be damaged. So this is error that happens in vaccine handling. And now in due to error in prescription of the vaccine, sometimes what wrong dose can be prescribed, sometimes wrong vaccine itself can be prescribed, and all these things happen. This comes under error in prescription. And now error in administration. Suppose if the sterilization is not done properly, some infections can spread. So this is error in administration. So immunization error means we have error in vaccine handling, error in prescription, or error in administration. Now anxiety related reaction, so that is actually it's just fainting itself. it is due to stress. Coincidental events. So this is actually not due to any of these things, not due to the vaccine or not due to error in this vaccine handling or prescription or anything. It is due to something else. It is not due to any of those four categories. So it is due to an already existing condition of the patient itself. Now let's see how can we prevent this adverse reaction. So first of all, you need to check for sensitivity before giving this serum or antitoxin, that is vaccine. And also adrenaline must be kept ready. See, what if the patient develop anaphylaxis after giving the vaccine? So the treatment options should be made ready before giving this vaccination, okay. And also the prescription and doses, everything should be correct, the site should be correct, and there should be proper sterilization of the syringe, the needle, everything. And also discard the reconstituted vaccine at the end of each section, never reuse later. And also the immunization workers have to be trained very well in order to avoid errors. Now, what are the investigations for an AEFI? Suppose if you are a medical officer, so consider a patient who had taken a vaccine from a sub-center, and the steps in the patient now had an adverse events. So this adverse event is detected, it is reported to the sub-center, and a medical officer is going to investigate this, and response will be taken. So let's see what are the investigations. So suppose if you are a medical officer and you are going to investigate about a AEFI, an adverse event that happens due to vaccination. So let's see what are the steps. So first one is confirmation in the confirm the information in the report. That is, you need to confirm everything which is given in the report, whether it is right. That is about the patient, about the event, adverse event. Just make sure it is real. And then what you have to do, you need to investigate and collect data. That is, data about the patient have to be collected. That is the age of the patient, the gender of the patient, whether this patient is having any previous illness, or whether this patient is taking medications for any diseases, or whether this patient already had an adverse event after immunization in the history. Likewise, you need to collect data. And now about the event. What was the event? Was it a seizure? Is it a fever? Or is it just breathing problems? And you need to mention exactly what is the event and when did it appear. That is, after how much time after vaccination it happened, and how long does it last. Everything have to be noted. And now about the suspected vaccine, you need to what was the name of the vaccine, what was it dose, its batch number, lot number, company, everything you need to investigate. And about the other people, that is, you have to check, does any other people who had taken the same vaccine from the same subcenter had developed the same reactions. So you need to investigate about this thing also. So these are the investigations. And now you need to assess the surveys, and you need to observe the surveys in action. That is, you need to assess how this vaccine is stored, how it is handled, and everything. You need to go to the subcenter and you need to see how this vaccination is given there in that place. You need to check for, is there any wrong method in administration of vaccine, are they doing something wrong, you need to find it out. So that is, and now you need to formulate a working hypothesis. That is, you need to classify this AEFI under those five categories. Okay, uh, is it due to a vaccine product property, or is it due to a defect in this vaccine, or it due to an error in immunization, or is it just a coincidental event, or is it due to anxiety, likewise. And now you need to test the working hypothesis. That is, you need to prove that AEFI category, and also you can do some laboratory test for this, and you need to conclude the investigation. You can make the final report, and you need to submit it to the state and national, likewise. And then what, you should also suggest some actions. What should be the responses that can be taken to prevent this, to prevent further AEFI in that place, likewise. So these are all the steps in investigation of an AEFI. So that's all about AEFI. Thank you for watching. Please like, share, and subscribe. Thank you.